I am Dr. Waseem Sajjad, and today we will discuss about cerebral aneurysms and how we can diagnose different kinds of cerebral aneurysms. Aneurysm is basically dilatation of the blood vessel more than its normal caliber. There are different types of aneurysms. They can be secular, they can be fusiform, they can be giant aneurysms, they can be mycotic aneurysms. The secular aneurysms are most common. Secular aneurysms, as the name shows, this is basically a sac-like dilatation of the blood vessel. It commonly occurs at the bifurcation point of the blood vessels. At the bifurcation of the blood vessels, there is sac-like outpouching of the vessels, and we call it as secular aneurysm. Then there are fusiform aneurysms. Fusiform aneurysms are due to the focal dilatation of a blood vessel. Similarly, there are giant aneurysms. If the aneurysm is more than 25 mm in diameter, we label it as a giant aneurysm. And there are third mycotic aneurysms. Mycotic aneurysm occurs due to the infection of the vessel wall. This infection can be bacterial, fungal, or viral. Most commonly, the bacterial infections are very common, and there is hematogenous spread of the infection from some other source in the body to the vessels of the brain, and this hematogenous spread causes bacterial inflammatory process of the cerebral vessel. As a result, the vessel wall is destroyed and it becomes wider than its normal caliber, and we call it as mycotic aneurysm. Mycotic aneurysms are most common in patients having endocarditis and IV drug abusers. In patients of endocarditis, there is septic emboli which are transferred from the heart to the brain. In the brain, they infect a particular vessel of the brain, and when this vessel is affected, then the vessel becomes dilated, and we label it as mycotic aneurysm. So, what are the imaging modalities which are used to diagnose aneurysms? CT angiography is the non invasive and the most useful technique, and the gold standard is digital subtraction angiography. In DSA, four vessel angiogram is obtained. Four vessel angiograph means right and left vertebral arteries and right and left internal carotid arteries. So, there are aneurysms at different locations. They can be in the anterior circulation or they can be in the posterior circulation. In the anterior circulation, the anterior communicating artery aneurysms are most common. There are anterior cerebral artery aneurysms. When these aneurysms rupture, they cause subarachnoid hemorrhage. Similarly, if middle cerebral artery aneurysm rupture, it causes hemorrhage into the sylvian fissure. If the anterior cerebral artery aneurysm ruptures, it causes hemorrhage in the pericallosal space. And similarly, in the posterior communicating artery aneurysms, if these aneurysms rupture, they cause bleeding into the basal cisterns, and posterior communicating artery aneurysms can also affect the oculomotor nerve, which is passing close to the posterior communicating artery, and the pulsatile uh, posterior communicating artery aneurysms can also cause the palsy of the third cranial nerve. Similarly, there are aneurysms in the posterior circulation. The most common location is the bifurcation of the basilar artery. Similarly, when these aneurysms rupture, they cause bleeding into the cisterns or into the spaces which are adjacent to these aneurysms. Now, the treatment of these aneurysms is important, and it is by endovascular coiling. Before endovascular coiling, we need to identify the exact location of the aneurysm, the exact size of the aneurysm, the size of the neck of the aneurysm, the length of the neck of the aneurysm. These points are important in endovascular coiling. These are all to be mentioned in the report if we encounter a cerebral aneurysm on imaging. And and the important point is that digital subtraction angiography should be performed as soon as possible after the hemorrhage due to rupture of cerebral aneurysm, because if we delay, there is high chance of rebleed within 24 hours, and there is also a high risk of vasospasm, and due to this vasospasm the next digital subtraction angiography becomes difficult. So, when there is hemorrhage due to cerebral aneurysm, try to perform digital subtraction angiography as soon as possible and try to cure the cerebral aneurysm by using endovascular coiling. If the aneurysm is smaller than 7 mm and there is no previous subarachnoid hemorrhage, it is debatable whether endovascular coiling should be performed or not, because the risks outweigh the benefits. So, this is how we can diagnose the cerebral aneurysms and treat the cerebral aneurysms.